Greetings, everyone. My name is Thokozani Liwewe, a Biosecurity Game Changers Fellow at the Pandemic Center at Brown University. It is my pleasure to extend a warm welcome to you all to the second seminar of the Game Changers Seminar Series organized by the Biosecurity Game Changers Fellows of the Pandemic Center at Brown University. We are thrilled to have you with us today as we delve into the crucial topic of biosecurity, biosafety, and the 100-day mission, guided by two esteemed experts in the field. Today, we'll explore what the 100-day mission is, how it came to be, and why it is important for health security. We will also understand the role of emerging technologies in accelerating the 100-day mission and the necessary guardrails to prevent the intentional and accidental proliferation of biological weapons, along with other critical insights that will be shared. Please feel free to engage and ask questions in the chat. So without further ado, I will now hand over to our moderator today, my fellow Game Changers fellow, Dina, who will introduce our distinguished speakers and lead us through the rest of the session today. Over to you, Dina.
Thank you, Thokozani. Good morning, good afternoon, good evening, everyone. Welcome to this seminar. Thank you, Thokozani, for giving us a rundown. And I hope we are going to have a good time and learn about the 100-day mission. We have two very special guests with us today, and I will just introduce them briefly and give them a chance to introduce themselves fully. So with us today, we have Dr. Claire. We have Dr. Claire Stanley. She's a Senior Biosecurity Initiative Lead at the Coalition for Epidemic Preparedness Innovations, that's CEPI. And we have Dr. Tokmo Maruta, the Director of Programs at the African Society for Laboratory Medicine, ASLM. You are very welcome, Dr. Claire and Dr. Tokmo. I will let you introduce yourselves properly for this very distinguished batch of guests, and we shall take it from there after that. So, Dr. Claire, please.
Thanks so much, Dina. Hello, everyone. It's wonderful to be here with you today. Looking forward to a robust discussion. Not much more to say by way of introduction, just that I'm an infectious disease ecologist by training, came to biosafety and biosecurity by way of supporting programs for capacity strengthening around the world at the State Department, and have recently been in academia for about 10 years, conducting research on epidemic preparedness and response and health system strengthening. Maybe I'll hand it over to Dr. Maruta.
Thank you very much, and greetings to colleagues that are online. Tokmo Maruta is my name. I'm currently the Director of Programs at the African Society for Laboratory Medicine, which is a Pan-African organization which implements programs in Africa in the diagnostic space. In my previous life, I was also working for the Africa Centers for Disease Control, coordinating their biosafety and biosecurity initiative in the African continent. So it's a pleasure to be here. Looking forward to the discussions. Thank you.
Thank you very much, Claire and Dr. Tokmo. I will just ask the both of you, we are hearing about the 100-day mission, and there's all this talk and discussion and interesting global discourse going around about the 100-day mission. But Claire, would you like, give us a rundown. What is the 100-day mission? Why 100? What informed this thing? So we see a lot of 100 and figures. So what is this? Could you just give us a synopsis of what it is?
Absolutely. So first of all, it's important just to mention that historically vaccine development and the response to epidemics and pandemics has taken a long time. So typically we think of a 5-year plus timeline for getting vaccines developed for new threats and safely into the arms of people. And so the 100 Days mission basically articulates this bold vision of a world where that type of response can happen in just 100 days. It's not an exact vision, it's just an indication of the paradigm shift that we're looking for in terms of speed from detecting a novel threat to being able to produce accurate diagnostics, and then also, of course, the suitable countermeasures and therapeutics, including vaccines that can be delivered to prevent those threats from becoming pandemics that affect all of us. So, and maybe I'll stop there for now. I've got a few slides later that delve into this a little bit more detail as well. Oh, you're muted, Dina.
I'm sorry, technology. Thank you for that, Claire. That was wonderful. Thank you for breaking us into that. I will now ask Dr. Tokmo, would you tell us why do we have this? What informed the 100-day mission? What's the context that brought us to this point? Has it always existed? When did it come? What happened to bring us to this resolution we have called the 100-day mission?
Thank you very much, and thank you, Claire, for laying the foundation in terms of what the 100-day mission is. But I think most importantly from what Claire said is that the experience we had from COVID-19 was that we needed to develop medical countermeasures that ensures that we minimize or reduce the window of pathogenic spread in order that we can minimize the impact socially, economically, politically, and health-wise. Therefore, the 100-day mission is saying, what is it that we need to do? What are the systems we need to put in place? What are the structures that are needed to ensure that that window period, we reduce it such that we are able to contain these threats that can either come naturally or accidentally. So what sort of medical countermeasures do we need to place? So this was not there before, and we have learned a lot of lessons from previous epidemics and previous pandemics, and this really has informed the 100-day mission. Thank you.
Thank you so much. Thank you so much, Dr. Tokmo, for that. And without further ado, I will hand it back to Claire to give us just an overview what this is, why it's important, the capabilities we need and we are aiming for to make it real. And she'll give us a presentation on that. And over to you, Claire.
Thank you so much. And yes, I apologize for having some slides, but I thought it would be helpful just to frame the conversation a little bit, and then hopefully we'll be able to get into a more open conversation a bit later on. So as mentioned, I'm going to speak a bit more specifically around CEPI's input towards the 100 Days mission and the vision that CEPI has. So as I alluded to earlier, and Dr. Tokmo also mentioned, the 100 Days mission encompasses quite a wide variety of activities and technical components that are necessary to bring us to that 100 days approach to stopping pandemic threats. However, CEPI's approach is very much focused on the vaccine aspects. So CEPI's mission, like many other organizations dedicated to pandemic preparedness and response, is of a world in which epidemics and pandemics no longer pose a threat to humanity. And our piece of it is really focused on the research, development, and manufacturing capabilities required to produce those vaccines to novel threats in 100 days. One of the things that was so important about the COVID response, which again was unprecedented in itself in terms of the speed at which vaccines were developed and shown to be effective and safely administered to millions of people around the world, was the fact that there had been prior research. There was this foundation of preparedness on related coronaviruses, for example, and even early funding that helped to then further develop these seed ideas towards viable candidates. And again, there were already platform technologies such as mRNA technologies, which then were rapidly leveraged as well to dedicate towards COVID-19. And just to highlight, I think, Dina, you asked about why 100 days. So hopefully this will give a bit of an illustration as to why speed is so important. So you can see that cases went up rapidly across the course of the COVID pandemic, and had vaccines been available within 100 days, only 2.3 million confirmed cases had been reported at that point in time. Whereas when the vaccine truly did arrive, it was 326 days in, and there were already over 65 million cases. So in theory, at least, many of those cases could have been prevented, and certainly the severe consequences of many of those cases could have been prevented through earlier deployment of safe and effective vaccines. And just to highlight the scale of this again, is that just looking at lower middle income countries, had we been successful at that point in the 100 Days mission for COVID, we could have potentially averted close to 5 million deaths, 800 million infections, and over 15 million hospitalizations, again, which have a large economic and social cost on society. So this is really, I think of this very much as a whole of society impact focused on that aspect of accelerating research, development, and manufacturing for vaccines. And again, this looks broadly speaking at the 100 Days Mission. So it's important to note that CEPI itself doesn't focus on all 6 of these areas, but we do really look at the vaccine research, development, and manufacturing aspects, and increasingly, and as I'll talk about a little bit more in a moment, the biosafety and biosecurity aspects that underpin safe, secure, and responsible research, particularly when we're talking about leveraging emerging and new technologies, which are going to be increasingly important to achieve that paradigm shift of timing that I think is so important if we are going to move from a COVID type of timescale of around a year to something closer to 3 months. So just to talk a bit about emerging technology and the 100 Days Mission, again, as I mentioned, we are going to have to leverage emerging technology, including artificial intelligence, most likely, in order to create those gains and that rapid increase of pace to achieve the 100 Days Mission. So just a few examples of where CEPI is using artificial intelligence in some of our work. And I should note, for those of you who maybe aren't as familiar with CEPI, that CEPI is a research funder. We don't do any of our own research in-house, but we support research, development, and manufacturing with partners all over the world. I think to date, we funded research in 47 different countries. Again, all focused around this idea of creating biologics and vaccines against pandemic threats. So, for example, a few examples here of the use of AI is analyzing the structure of viral families known to cause human disease, including to predict new variants. So, for example, CEPI has partnered with Harvard and a biotechnology company called A Priori Bio to look at how to use AI platforms to identify viral mutations that have the greatest escape potential. Again, this can help us to then plan out what vaccines might need to be developed in the future to address future variants that haven't even emerged yet. CEPI's also funded research that looks at potential antigenic targets that can help inform other aspects of vaccine design. And critically, again, in the context of the 100 Days Mission, to do this much more quickly than we've been able to do in the past. So, for example, CEPI has funded a consortium that's led by the Houston Methodist Research Institute in the US, as well as Leipzig University in Germany, to identify some of those virus proteins, those antigens that could be used in vaccine design, specifically looking on viral families that we consider to be emerging pandemic threats. So Nipah virus family, Lassa virus family, and the Junin virus family as well. And then I think another important aspect is using AI to inform prioritization of viral families. Again, the 100 Days Mission is predicated in the idea that disease X might be the threat that emerges, so an unknown disease at this point, but we can have an idea as to what type of viral family that disease X is most likely to come from. And so CEPI has been partnering with UC Davis to use its AI system to help identify some of those viral families and the ones that are most likely to cause spillover into humans from zoonotic sources, for example, and result in a future epidemic or pandemic. I think it's also very important to mention, especially in this context when we're talking about biosafety and biosecurity, that while we see that there are these paradigm shifting benefits of emerging technologies and artificial intelligence, new technology always comes with new risks. Some of these risks have already been very well defined, some perhaps are less so and need to be considered more carefully. I also just want to acknowledge that while I'll obviously focus on the biosecurity risks a bit more in the coming slides, there are other aspects of risks to emerging technologies and AI that are important. There's infrastructure requirements, which may reduce equity when it comes to accessing AI or being able to leverage AI successfully for health security. There's an increasing recognition of the carbon footprint that the type of vast computing power required for AI uses and what that might mean for our climate future. There's been a lot of talk already about data limitations and biases, and again, particularly how that might exacerbate inequalities or inequities, and needs to be very carefully considered if we want to make sure that these emerging technologies are utilized for the good of all people. And then, of course, we know about the dual use applications, which we can talk about a bit more in a moment, and where we typically see the biosecurity implications. So where does biosecurity fit into the 100 Days Mission? So I think that there is sometimes, unfortunately, a bit of a perception of biosecurity as a barrier to rapid and successful research and development. I don't like to see it that way. I think that biosecurity can actually be a real enabling factor that can help unleash some of those benefits, particularly of new technologies, by minimizing and mitigating risks. And so allowing that research to continue at pace in a safe and secure way. A few ways that I think we can achieve this. One is through establishing what we call rules of the road. So trying to create those guidelines, those protocols ahead of time during the preparedness phase, so that when we do enter into an outbreak scenario, we aren't hampered by biosecurity concerns being ill-defined or not in place. We've already had them in place, we've figured out what they are, we've established those rules of the road, and we're ready to go. And this is a vital lesson that we've learned from past outbreaks, that we need to have those processes during the preparedness phase to allow the response to run smoothly. A really critical aspect is that we know that any research with infectious diseases, with pathogens, does come with some level of risk. It's impossible to have no risks in when you're handling pathogens. And so having effective biosafety and biosecurity in place does reduce the risk that the vaccine research and development processes themselves might inadvertently cause an outbreak or, God forbid, the next pandemic. We want to make sure that all of the 100 Days Mission research is carried out safely, securely, and responsibly. And then, of course, as we've mentioned, a core component of the 100 Days Mission is advancing novel and innovative technologies for vaccine development. Again, focusing on vaccines from a CEPI perspective, but the same could be true for surveillance technologies, for diagnostic technologies, and other aspects of therapeutic development as well. And so strengthening biosafety and biosecurity to minimize adverse risks of these technologies is going to be absolutely crucial to enable those benefits to be unleashed in support of the 100 Days Mission. And so just a couple of ways in where CEPI has been working specifically over the past year. So one key initiative is the Biofunders Compact, and CEPI was a founding member, a founding signatory of the Biofunders Compact, which was launched in June 2024 at the Global Health Security Conference in Sydney, Australia. And this is a compact that commits research funders to incorporate biosafety and biosecurity into their funding processes to safeguard life science research from accidental or deliberate misuse. And then another initiative is the Responsible Biodesign Initiative. And so this is a set of community values, a set of voluntary guidelines and guiding principles for safe and secure use of artificial intelligence in protein design specifically. Again, a key aspect of using artificial intelligence for vaccine design is maybe looking at new antigens that can be targeted. And so again, this provides some guiding values around how to do that safely, securely, and responsibly. And just, I want to underscore really that, at least from CEPI's perspective, equity is at the heart of the 100 Days Mission. And in fact, that is very fundamental to the initiative as a whole. The central goal is to enable the availability of vaccines, medical countermeasures, and other tools for pandemic preparedness response to all of those at risk, regardless of where they are. And certainly from CEPI's perspective, there's a real interest and commitment to ensuring that those vaccine research, development and manufacturing capabilities are established in all world regions. And so to do that, we do need to both broaden understanding of what biosafety and biosecurity risks might come with that kind of research in order to effectively mitigate them, but also to strengthen global capacity so that that kind of research can be done safely, securely, and responsibly all around the world. And in support of these efforts, I just want to mention CEPI's biosecurity strategy, which you can see here. And this was launched on the margins of the UN General Assembly in September last year. And it's received some really exciting and positive global feedback, which we're really excited about. And the strategy addresses 5 intersecting priority areas in line with CEPI's overall mission and vision, related both to vaccine development, but also its biosecurity principles. And these 5 priority areas are oversight of research, partnerships and capacity strengthening, that core concept of equity underpinning everything else, emerging technologies and artificial intelligence, and then really driving innovation in biosafety and biosecurity to support vaccine research, development and manufacturing. And this strategy is available online, so I certainly encourage everyone to look at it. And excitingly, we're hoping to move forward with implementing this strategy in the years to come. So looking forward, I'm sure, to collaborating with many of you listening today on that in the future. But I'll stop there and pause and hand it back over to Dina to take us into the next session, and looking forward to the discussion.
Wow, what an amazing discussion. What an amazing presentation. Thank you, Claire. Very thought-provoking presentation. very well elaborated on the 100-day mission. If there is one thing I've taken away, it is safely, securely, and responsibly. Yes. So before we jump into the discussion, I'll hand it over to Dr. Tokmo to just give us a picture of Africa's capabilities. Are we ready with what we have? What do we have? What don't we have? Where are we at? And what are the prospects that we have as a region? So Dr. Tokmo, please, you have the floor.
Thank you very much. And I'll also pick from your words, which says, safely, securely, and responsibly. And those three words hinges around our capacities and capabilities in biosafety and biosecurity. And unfortunately, when you look at the recent global indices around your Global Health Security Index, the WHO Joint External Evaluations, the picture is not very good as far as our capacity and capabilities in biosafety and biosecurity within the region. And this is very central when we talk about medical countermeasures, because we are looking at medical countermeasures, biological medical countermeasures for biological threats. You need to have either vaccines, you need to have therapeutics or oral diagnostics to be able to identify the agent that may be causing the problem. And for you to do that, for you to come up with vaccines, for you to come up with therapeutics or diagnostics, you may have to, one way or the other, work with some of these dangerous pathogens. Then it means we need to have systems, institutions, and structures that then ensure that this is done securely and responsibly, as we have mentioned. So with the background of the lack of capacities and capabilities, I will speak from an angle of some of the programs that have been running across the Africa region and try to speak about how do these link and are important to the discussion of today. Africa CDC launched the Biosafety and Biosecurity Initiative, and the goal of this initiative is really to try and strengthen the biosafety and biosecurity capacities of our African member states, such that they can then be able to have these structures and systems we're talking about that are needed for us to be able to work responsibly, securely, and safely with some of these pathogens as we develop our medical countermeasures. So when you look at this initiative, it has a number of areas that are critical for our discussion today. One of these is just regulation, coordination. So we talk of oversight. So who then should be responsible for this oversight? When you look at biosafety and biosecurity, it's a whole government approach initiative. It's a multidisciplinary, multi-skilled, which then means it cuts across many disciplines, cuts across many departments, and even ministries within the same government. So then the issue of who then takes the responsibility of oversight of compliance to these issues is sometimes a big challenge within the continent. So one of the areas that the initiative is trying to address is to support countries establish those oversight mechanisms that have the mandate, that have the legal power and legal teeth to enforce compliance. So it's very critical, I think, that element to ensure that there's proper oversight. The second aspect it's also looking at is legislation. We saw that during COVID, one of the things that delayed response in some countries was just that there was no legislative framework that supported many of the interventions that we had. We had people suing each other. We had people going to court to stop measures. And this simply because in some instances, we don't have properly designed and legislation that covers wholesomely the issue of biosafety and biosecurity. So we are working with member states in this initiative to establish and develop that legislative framework that covers the issues of biosafety and biosecurity completely. So one of the issues that's there is the issues of oversight mechanisms. So supporting countries to establish institutions or agencies that are responsible for compliance to biosafety and biosecurity. And these institutions should be institutions that are made up or constituted in a multidisciplinary fashion following the One Health approach. an institution or agents that has powers to enforce compliance. So it means there has to be some law that supports it. It has to be enacted by an act of parliament to ensure that it has the appropriate teeth. So the issue of legislation. Another component, again, is just the training and capacity building of the boots that are required on the ground as we implement these countermeasures. For us to respond, we need experts to be in the field. And biosafety and biosecurity is a relatively new discipline. Therefore, we need to build the human resource. We need to build the experts such that there is that sage capacity that is ready for us to deploy and counter some of these biological threats within the 100 days. So we're also looking at how do we professionalize this area of biosafety and biosecurity by coming up with training programs that develop this area. I'm also happy that right on our screen and coordinating this webinar today, the young scientists and young professionals who are upcoming in this field to be leaders and policymakers in the biosafety and biosecurity space. So this is needed as of yesterday. And as Africa, we're also working to see if we can build this capacity in that space. And then there's just the issue of managing some of the institutions that contain these pathogens. So for you to develop vaccines, for you to develop therapeutics, diagnostics, like I've said, in one way or the other, you need to be working with these pathogens. And when they are detected, they need to be managed properly. So where are these pathogens going to be kept? Where are they going to be contained? I have to say that in the previous years, we have seen these pathogens being taken out of Africa to some places and never see their way back, coming back as vaccines, coming back as therapeutics, coming back as diagnostics at a very high cost, but they are originating from here. When we have outbreaks of Mpox, Marburg, we are buying these test kits from outside of Africa in countries that have never experienced these outbreaks. How do the pathogens get there? One of the reasons given is that there's no capacity in the region to maintain these pathogens. So we are really working with countries to establish this infrastructure, ensuring that we have these containment facilities up to standard such that they are able to keep and securely maintain these pathogens. So we have a program that we are running where we assist member states to build this capacity, also the human resource to manage these high containment facilities to ensure that we are then able to manage responsibly and securely these pathogens when we face them during pandemics or outbreaks. But the challenges are real. As I have seen, as I have said, we are starting from far, but this does not mean that we should not get started. I'm happy that this initiative, we are working with many partners, many collaborators from within the region and outside the region to ensure that we have proper oversight, we have appropriate legislation, the right infrastructure, the right human capacity to be able to work as such capacity when needed. Let me stop here and also ask others to weigh in on the subject. Thank you.
Thank you so much. Thank you so much, Dr. Maruta. That's a very elaborate discussion on biosecurity in the context of Africa. Claire, would you like to weigh in on some of the things that Dr. Maruta has highlighted?
No, I mean, just to agree with everything that he said, and obviously, you know, ASLM and Africa CDC and other partners are doing an incredible job across, you know, a large, diverse set of countries to strengthen capacities. And I particularly appreciates him underscoring the importance of fellowships like the Biosecurity Game Changers. And certainly, I think maybe we can talk a bit more in a moment about these opportunities for strengthening capacity from Africa and the Global South more broadly. But certainly, this is a great initiative and a great starting point.
Thank you. Well said. Just to remind everybody attending, we have a Q&A button where you can ask your question, or room where you can ask your question to either Claire or Tokmo, and feel free to make a comment if you wish or to add. But I will, in the meantime, address something to Dr. Tokmo, maybe to Claire later. So Dr. Tokmo, Africa CDC has a vaccine manufacturing strategy that they rolled out. And it is to, I had written it down somewhere, but I've lost my notes. But it is to make sure that Africa had capacity to manufacture its own vaccines when the next outbreak comes, by the time the next outbreak comes. And there's been a series of steps that have been outlined in that strategy in terms of the gaps and of how to address the gaps that Africa has towards that. So my question to you would be, on this mission, this race towards producing our own vaccine, where are we at? Because it's very essential in kind of trying to work our way towards a 100-day strategy. It's 3 months, and with our manufacturing and R&D capacity, where do you think we are at on the race to 100-day mission as a region, Dr. Tokmo?
Thank you very much. So I think, yes, COVID-19 really taught us a lesson that we need to have this capacity within the region, just from the experience of the struggles that we had to access vaccines. And when they're available, they also come at a cost to and a burden to already burdened health systems in the region. Also, just when they're available, the systems to support that within the health system is also still in development. How do you deploy them when they arrive in the country? The issues of cold chain, who administers these vaccines? How do they move to where they are needed? How do you ensure that the public is ready to accept these vaccines? So a lot is needed. But as you said, we need to start, and I'm happy that at the Africa Union level, at our heads of state level, this need has been appreciated. Many steps have already been started. Like I've said, there are several meetings that have been convened to try and put this issue on the table. There was recently in Egypt where there was a meeting on this issue, and several countries have started the steps. But let me speak from the challenges perspective that we still face a lot of challenges as Africa as we push this agenda for vaccine. Pathogen economics is a very high value dollar industry. So it comes with a lot of challenges as we try to implement. When this was tried during COVID, one of the issues was that the vaccine could have been available in some countries, but the market, was the market ready to take these vaccines that were being produced here from Africa? We still saw some countries still sourcing vaccines from outside, yet within the continent, there were countries that were producing these vaccines. So a lot is needed to prepare the ground to ensure that the region is ready to take this up from our fellow countries. We still also need to work over the overburdening process of adopting innovation when it comes, not only in vaccines, but in many other technologies. So if I have an idea, is the environment conducive as a hub to incubate this idea? Is the environment created to such that it promotes this innovation? So there's a lot of, the processes are quite bureaucratic, the processes are quite overburdening, such that then within 100 days, you may still be trying to register your innovation, and 100 days will pass. So we really need to work a lot on the ground. Is on the other side, we are also promoting the issues of vaccination. So yes, there's a lot that's happening, but there's a lot much more that we need from my end, especially preparing the ground in the local market, the local population, to be able to uptake this with the speed that is needed, because we only have 100 days in order to effectively minimize the impact economically, socially, and politically. So the environment has to be very conducive for that. Thank you.
Thank you so much for that, Dr. Tokmo. I like the fact that you highlighted subtly the importance of community engagement, because no matter how much you produce, if people are not willing to take it, and from the African context, when the community is not cooperating, it will not cooperate. So thank you for highlighting that. Claire, before we jump into the questions, there is an interesting question I had for you. So when it comes to AI and it being used for technological advancement and kind of creating these technologies that we need for the 100-day mission, the vaccines, the therapeutics, the diagnostics, I came across a framework that is called the WMD P framework. Sorry, let me get that, where it is one of the interventions that was put in place by tech experts to see if the technology that was actually being used to create diagnostics, to what extent that technology, that AI model can use that information to generate a toxic molecule. So would you please just, tell us more about that maybe?
Yeah, and I think the
in terms of-
initiative you're referring to is maybe the Global Partnerships, WMD,
Yes.
initiative around, forecasting technologies. Yes. So, I
Yes.
mean, absolutely, this is really the fundamental dual use challenge with artificial intelligence. So it's important to remember a couple of things. One is that artificial intelligence models are only ever as good as the data that they're trained on and the data sets they're trained on. And so, that's just one source of potential bias and limitation that come from the models. They can't generate out of nothing. They have to be trained on certain data sets, at least at this point in time, the models that we have available to us now. And when it comes to things like creating either accidentally or deliberately using these models for harm, that's obviously been a concern from the beginning. The idea that you could ask a large language model like ChatGPT for instructions on how to create a dangerous pathogen, or perhaps you could use it to design a dangerous agent. And so again, I think that there's a number of different ways that we can start thinking about guardrails and protections against these. So some, as I mentioned, come from the community themselves, right? We can instill community values, we can create guiding principles, and we can encourage both research funders, but then also research implementers and individual scientists and practitioners to sign on to these types of community principles that will provide a certain level of guidance around what is considered responsible behavior when it comes to these technologies. And then maybe one other important area of guardrails, I think that it's worth mentioning, is the digital to physical barrier, right? So we can talk about the idea of creating protein structures that might cause harm or might be more dangerous, or creating sequences of pathogens that might incur different virulence or transmission characteristics. But as long as those are in silico, those are just on a computer, they're actually not causing direct harm to individuals. But there is that process by which you can change those designs into a real physical object. And that's where initiatives like DNA synthesis screening and other types of approaches that tackle that barrier between the digital and the physical become so important, so that even if something were designed that were harmful, it cannot actually be produced and unleashed into the world. And so I think that these are a number of the ways that people are thinking about these things, but I'm sure there's going to be more. And I think that, Talkmore mentioned innovation. I think there's also going to be ways that we can innovate around safety and guardrails that don't hamper the speed of development and of research and of manufacturing, but that intrinsically build in some of those safety and security requirements that we need to really, again, unleash those benefits and unleash the efficiency of these processes. So I think I take quite an optimistic view of the technology, but I do think that we need to harness this for the public good. And so we need to just work together to do so safely and securely and responsibly.
Thank you, Claire. The idea of technology and AI it can be a little bit polarizing, because you've got the absolute skeptics, you've got people who don't know what to do with the information, and then you've got the absolute enthusiasts, and then you've got, the optimists like you who can see the opportunity in that. So I'm always very intrigued by where the conversation may go when it comes to AI and bioconvergence and using AI technologies to advance medical science and public health. So we have some questions in the chat, and I will direct one to Talkmore. So we have a question that says, how can you assess the biosafety and biosecurity compliance of clinical and diagnostic labs across Africa? I'll direct that to Talkmore. How do you assess compliance of these diagnostic labs across Africa when it comes to biosecurity and biosafety standards?
Thank you very much. So I think, fortunately, one of the interventions within the Biosafety and Biosecurity Initiative is to assist member states develop a national biosafety and biosecurity strategy. So without proper planning, without proper strategy, it becomes a bit challenging even to mobilize resources and make sure that you're organized. So there are guidelines that are out there. How do you develop a national strategy for biosafety and biosecurity? One other thing that's very important that we also promote and support is to ensure that countries establish structures like biosafety and biosecurity technical working groups. So these are sort of oversight mechanisms in the country that then ensure that there is proper coordination of implementation of biosafety and biosecurity. And this becomes entry points for organizations like Africa CDC, ASLM, CEPI, and others, because it's easier for entry to support a country when there's an organized structure in there. Biosafety and biosecurity cuts across many disciplines. So do you go to health? Do you go to animal health? Do you go to higher education? Do you go to security? So where do you land without entangling yourself in internal politics? So establishing such mechanisms like national technical working groups really makes it easier. It then means this internal system is a way of being appropriately coordinated. There are also training programs that are there offered by many organizations, many institutions. But like I've said initially, the initiatives is looking at professionalizing biosafety and biosecurity. We have trainings in biorisk management, training in biological waste management, training in management of high containment facilities, and training in maintenance of biosafety and biosecurity equipment. So these are some of the interventions that countries can take advantage of as a way of strengthening their compliance at facility level. What's also important is that how do you ensure that biosafety and biosecurity is prioritized from the facility level up to national level? So there's need to continue to advocate for resources to ensure that countries are supported. We also have programs that train people that evaluate and assess facilities. So being trained in assessments, biorisk assessments, biosafety assessment. These are critical to ensure that we have a mechanism of checking for compliance, identifying where there are gaps, and then coming up with organized ways to support these countries. There are also programs that support infrastructure development to ensure that the infrastructure we have meets the requirements for biosafety and biosecurity, meets the standards that have been set by WHO and others. And there's also support for other things like consumables that are needed and so forth. So I think there are many ways that are there, but what's important is to be organized at national level. Your biosafety and biosecurity strategy, national structures like your biosafety and biosecurity technical working groups will be very important. Thank you.
Thank you, Dr. Tokmo. Thank you so much. Just since you're talking about biosecurity, biosafety, somebody also asked a question about where are we with the implementation of the Biosecurity and Biosafety Initiative 2021-2025 strategic plan. What do we have in place so far? What capacities have we built, and what do we need going forward?
Thank you very much. I can spend the whole day talking about that one. But in a nutshell, the first phase of strategy is coming to an end this year. Sometime in May, June, we'll be calling experts from the region for us to evaluate what has happened in the last 5 years as we prepare for the next strategy. We'll also be calling people on a consultative process. We'll be doing region by region over the 5 regions to collect your ideas, your thoughts. What do you want to see in the next phase? But let me speak about a few things. One, we managed to create a regional framework for biosafety and biosecurity legislation. So agreed by all member states, endorsed by the AU structures, recognized by our heads of states in the Lusaka summit in 2022. So that's very big. It means now we have a model law at a regional level. We've already started domesticating this. Last week I was in Sierra Leone. There's a team that's in Botswana this week. They've been to Burkina Faso, Namibia, and other countries to domesticate this. So we need law for us to help us establish all these structures we're talking about. We have a locally endorsed and agreed regional training and certification program that has been running in the 3 centers of excellence in Southern Africa, at NICD, in East Africa, in Tanzania, West Africa at the Institut Pasteur, Dakar, Senegal. So these centers of excellence have been running courses where we have been training people in 4 areas of specialization: biorisk management, biological waste management, management of high containment facilities, and establishment of regulatory framework for institutions that are handling high-risk pathogens. So we've been building capacity, professionalizing biosafety and biosecurity, and we have over 300 people that have gone through this program. We also have a framework for certification of institutions that are handling high-risk pathogens. Like I've said, there's this notion that we don't have the capacity to maintain these pathogens in the region. So we agreed as a region to say, let's come up with the minimum standards for us. Let's train people to evaluate institutions on the standards, and let's certify those that meet the standard. We were last year in Uganda, UVRI, that was certified. In the next 2 weeks, we'll be in Negushi in Ghana to also certify the institution there, so that they have authority to maintain this pathogen safely and securely, as we have spoken about, and many other initiatives that I can speak about all day. But watch the space. We'll be issuing out a report of what has transpired in the last 5 years in an end of first phase strategy evaluation that will be starting in April up to May. Thank you.
Thank you for that, Dr. Maruta, very well said. So Dr. Claire, I have 2 questions for you on the chat. One is, what is the role of government in the 100-day mission? How do we advocate and how do we engage governments to kind of participate and buy into this at the national level? And then number 2 is somebody is wondering if there are specific efforts to support innovation and development of diagnostic products, and therapeutics, given the range of viral families that we have to deal with and the range of just the sheer load of microorganisms. Are there specific efforts? Are there research, incubation hubs or opportunities that can be leveraged towards this end here?
Great questions. Thanks so much. So on the role of government, I think it is important to note that while CEPI was one of the organizations that first proposed the 100 Days mission, it wouldn't have been able to be launched and as widely known about today if it weren't for the support of government. So in fact, it was officially co-launched between CEPI and the UK government during the UK's presidency of the G7. And since then, the G20 countries have also taken up the 100 Days mission and adopted it as part of their overall vision for pandemic preparedness in the future. So again, already that's a number of countries. And I think the more that we can encourage governments to commit to those goals, the more the rest of the infrastructure can come along with it. And certainly we wouldn't get anywhere without the support of other regional bodies like Africa CDC, let alone the technical organizations that do all of the hard work, as Tokmor has been describing already. So I think, in that sense, governments often are also important in terms of providing the financing for these activities. We can't get anywhere without providing the funding supports. And so, I think that there is both that political will, the support and the commitment to the goals and the vision of the initiative, but also backing that up with hard cash to make sure it can become a reality. So a number of ways there to move forward. With respect to the pathogen agnostic diagnostics and maybe other aspects of therapeutics, just quickly on the vaccine side, I briefly mentioned this idea of looking at viral families and using AI to develop antigens. So part of that is somewhat pathogen agnostic in the sense that they are looking across a range of antigens that might be applicable to those viral families as a whole. And so creating a viral vaccine library, as it were, that can be quickly drawn upon and leveraged when a new disease emerges. So again, you imagine disease X comes, you quickly identify it, hopefully you can quickly sequence it given technologies now and say, okay, it's most closely related to this particular antigen that we have in our library, and then we adapt from there potentially. On the other side, again, CEPI doesn't directly work on diagnostics at this point in time, but I just want to mention very briefly the idea of leveraging genomic surveillance in support of the 100 Days mission. And that's another big African initiative that the Africa CDC has been leading over the last years, and maybe Tokmor can briefly speak to it as well. But the idea that if we can enhance next generation sequencing, which is already quite widely spread across the African continent, there's a number of important initiatives that have been broadening that capacity and strengthening it across different countries and regions within Africa. That is in its sort of base sense quite an agnostic technology for rapid detection and, importantly, characterization of emerging pathogens, and of course variant tracking, as we saw in COVID, which became so important as trying to ride the new waves of the pandemic over the course of those early years. So I think that a lot of it is already there. It doesn't mean that we can't do more, we can't do better. I think the idea of agnostic therapeutics is really interesting, and maybe you're onto something there that could be developed further. But certainly this is the future, right, in terms of thinking about disease X and achieving the 100 days mission for sure.
Oh, absolutely. Dr. Maruta, do you want to weigh in on that?
Yes, I think I will speak from the perspective, when you speak about government, one of the things that we need to, as we design programs, is ownership. So at the end of the day, it is the government which is responsible for its citizens. And if there's no local ownership of our interventions, no matter how good they are, it becomes extremely challenging to implement them. So our approaches must ensure that they promote ownership. The second issue is just on contextualizing our approaches. I think in a lot of cases, they are very nice interventions, but these are not contextualized to the different regions. We have our unique challenges. Therefore, it means they require unique approaches. So do we use a one-size-fits-all for everyone? This may be challenging because the 55 countries, we are all at various stages. So do we approach all of us the same way? That may not be the case. So these are the lessons we've learned. And it squarely lies on working with the government so that they can appropriately advise on how we should proceed. And sustainability becomes very important for government. They are, like I've said, they are responsible for their citizens, and they are worried about tomorrow, not just today. The intervention you are bringing, there are many other things. So we are talking of the 100-day mission. The other Minister of Health is worried about no water, worried about cholera outbreak, worried about the Minister of Housing is worried about people who don't have houses. So they have a lot of things that they are thinking about. So your approach has to have the hallmark of sustainability. I'm happy Claire brings in the issue of genomic surveillance. Really, Africa CDC has worked with its partners in the region to build this capacity from just 2 countries who were able to sequence COVID-19 when it came to over 35 right now in the continent with capacity for genomic sequence is something out of this world in a very short time. Why was that successful? You put government at the center, you make sure that you contextualize your approach and speak of sustainability. Now we are taking advantage of this capacity for new test cases. So laying the foundation has been there. So if any other pathogen that comes, we're not starting from scratch. We already have the capacity for genomic sequence. Therefore, the 100-day mission then makes sense. Thank you.
Very well said. And I will speak for Uganda and say, whoop, whoop. Yeah. Yes. I think Africa is actually rising in its capacity. I mean, we have a lot of things going wrong, but when it comes to capacity for genomic sequencing, for example, and science and tech, and even vaccine production, there is capacity that is coming up. I believe in celebrating incremental incremental development, incremental wins as we run towards a big goal. So I think we have time for just one more question, and I'll phrase a complex question for both of you. So one of the things that Tokma already you've touched on was is raised by one of the questions in the chat is about the fact that the global South and Africa, generates most of the pandemics and the global threats, to public health, and yet all the innovation is happening in the global North. So one person raised a question about access. How do we bridge the gap and make sure all these amazing tech-inspired innovations are actually reaching the bottom person, and reaching the person most in need? Because, with the incentives around tech and innovation and science and information sharing and tech transfer, there's complexities in that need to be addressed before we come to the reality of this 100-day mission if we're going to take diagnostics and therapeutics down to where they are really needed. So a comment on that. And then lastly, it's about also a bottleneck in the 100-day mission, and it's addressed to you, Claire, saying that many times when vaccines are produced, we need a research. There is a research ethic that needs to be, a research protocol that needs to be followed. And so we need clinical trials, we need approvals, we need all that before they can be trusted by scientists, politicians, and the community to be safe for the human population and for use. So how do we accelerate, the production of these vaccines without breaking the integrity of science and safety, and make it acceptable for consumption for the person who is consuming it, convincing that it's safe, and even the governments that are going to procure these elements, because we are used to this whole dragged out process of clinical trials, safety, phase 1, phase 2, phase 3, and then it goes back, and then safety profile and all that. But now this 100-day mission seems to be skipping, way too fast. So how do we help people understand and kind of generate that trust in the technologies? Yeah.
Well, I see we have 3 minutes left, so this will be far too abbreviated a response, but I certainly hope people will feel free to follow up afterwards to discuss further, because this is a great question. I think the point is that we absolutely need to think how to do it safely. That's obviously the bottom line. And there are some really exciting, innovative ways that we are addressing some of those previous bottlenecks in the vaccine process. There's things like pre-approvals of certain types of vaccines. There's the idea of having experimental use authorizations, as we saw during COVID, to accelerate the deployment. We're also, I think that there's an ongoing conversation, an important conversation that I think also necessarily has to include individuals from all world regions to make sure that it's not biased towards one region or another, around other approaches to clinical trials, like controlled human infection models, for example, which is something that CEPI has invested in as a way of accelerating, under very controlled circumstances, the clinical trial process. So lots to say there, but certainly this is not about, it's just important to underscore, this is not about skipping ethical steps. It's not about bypassing ethical approvals or skimping on safety. It's about finding innovative ways to ensure that those aspects are deeply integrated into the process, prepared for as much in advance so they can be unleashed really rapidly during the actual vaccine development and rollout process. I'll let Tokmo speak a bit to the idea about innovation, unlocking innovation in the Global South, but I just want to quickly challenge the premise that pandemic threats always come from the Global South. I think we're all aware of what's happening with H5N1 in the United States at the moment, and we certainly are seeing real threats coming from other parts of the world too. So as has been said many times, a disease in one country is a disease threat everywhere. So let's try not to place the blame and rather work together to solve problems and enhance preparedness.
We are fighting for pandemic pie. Talk more.
Yes, very quickly. So very quickly. So I think the principle is that no one is safe until everyone is safe. So it's unfortunate we have names like Global North, Global South, but for me, it's one globe. We are so much connected. Disease, they don't know any boundaries. So the bottom line is we simply need to work together. There is no other option or any other way around this. But I'll put the ball in our court this side, that there are things that we need to put in place, ensure that there's proper oversight mechanisms, appropriate legislation, strengthen the human resource capacity, and continue to mobilize for resources. If we are organized, people are also able to help us in moving into organized structures. And so I always put the ball in our court at this end. Thank you.
All right. Thank you. This is all we had time for. Thank you so much, Tokmo and Claire, for being here and for attempting to just unravel this thing in the one short hour that we've had. I'm sure there's lots to say. There'll be lots more to say. Please, if you want to follow more of these conversations, feel free to tune into. We have a podcast as a Game Changers Fellows that kind of attempts to unravel some of these complex issues. And we shall be having some episodes there on the 100-day mission as well. So please feel free to tune into that. We also have the Next Gen Declaration from the Munich Security Council. Tokmo talked about building leadership and leadership capacity and talked about Next Gen. So the Next Gen have just pitched a proposal to the world, which it's a declaration from the Munich Security Council, and they would like you to take a look at that. It's on the 100-day mission, and it's our proposal as Next Gen on how we can move it forward in terms of accelerating collaboration and getting people to see what's out there and their part and their role to play. There's been lots of questions about what's my role to play, how do I engage, where do I come in? And so read that Munich Declaration and you will perhaps get inspired on where you can plug into this. Otherwise, thank you for joining us for this amazing conversation, amazing crowd here. We shall keep the questions. Hopefully we shall attack those. In Uganda, we say attack. It is not a literal threat. We shall attack those in some of our podcast series. And thank you for being here. Without further ado, I'm going to wish you a good night because I'm a talker. And I hope to see you next time on our next seminar. Bye.
Thank you, Dina. Thank you.
Thank you.